Omicron is unlike any COVID variant we've seen so far, but that's not fully a bad thing. There is some good news on the horizon. We just have to make it there. As Omicron spreads, health officials are calling for a shift in the way we look at COVID case data.
Data is not helpful unless it gives us information, and information has to give us knowledge that will help us to act on it.
The shift away from total case counts as a COVID metric and towards hospitalizations isn't just an adjustment in our interpretation of the numbers. It signals a turning point in the pandemic itself.
As many scientists, epidemiologists start to discuss whether or not counting cases is relevant anymore, tells us that we are starting to shift the paradigm.
We are at this sort of pivoting point that we have to deal with COVID as it is shifting towards becoming more of an endemic.
Endemic diseases are those like the seasonal flu, constantly present in a population but rarely causing massive healthcare crises. Officials agree COVID is not going away.
There should be some prevalence of COVID around us at all times for years to come.
But Omicron is the closest variant we've seen yet to the high transmissibility and low severity of other endemic diseases.
I would like to say COVID will look like the flu.
Though officials are careful to remind us we're not out of the woods yet.
If we really build immunity with this infection, it might be hopefully a good thing if it doesn't exhaust and kill many people.
Doctors across Kern County continue to urge the importance of vaccination and masking as healthcare systems continue to be overwhelmed. It's important to note most of this speculation is based on models out of South Africa, Great Britain, and other countries with high vaccination rates. Severity could be higher here in Kern, where about half of the population remains unvaccinated.